Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am speaking with Kimberley Tateson-Bennett, Director of Health Services, and Elaine Wilson, Senior Director of Operations of CACHC Calgary, Community Health Centre in Calgary, Alberta. CACHC Calgary provides a wide range of health and social services geared to the diverse needs of individuals, families, and groups in the Calgary area. This episode of Community Matters will be centered around the work CACHC Calgary has achieved through the PHAC-funded Project for Community Vaccine Promotion, CVP-National Project with CACHC. How are you both doing today?
Great, thank you.
Awesome. So first off, I would like you to each tell me a little bit more about your community health center, some of the main aspects of your organization, the communities that you serve, and the services and programs that you provide at CACHC.
Sure, thank you. So CACHC is a community health center based here in Calgary, and we provide integrated healthcare, housing, and education supports to primarily low-income Calgarians facing adversity. So we provide really collaborative, coordinated, trauma-informed, holistic services to clients based on their needs and strengths. And we're really focused on integrating those services for the clients here at CACHC as well as in our community, and ensuring they have access to all the supports that they need. So we run a primary care clinic where clients have access to physicians or nurse practitioners, but as well a real variety of other health services such as opioid agonist treatment. We have a liver clinic on site. We offer women's health and pediatric services, mental health services, including psychiatry, and a variety of other visiting specialists. So we really try to bring the services in-house for clients who are low income, struggling either with homelessness or potentially vulnerably housed. So facing a lot of barriers to access, we try to create as much availability on site. And as well, we offer housing programs. So we have 4 different housing programs, including intensive case management, where we support individuals living in community market housing. We work with clients who are trying to re-engage with their community through our community development program. And we also work with clients who are trying to exit out of the homeless serving system of care through a graduated rent subsidy program. And the last big chunk of work we do is around that 2-generational approach through our child development and family development centers. And so these programs together really work to co-create positive outcomes for low-income families in Calgary. We work to increase stability through housing, food security. We do a lot of parenting and coaching, capacity building with families. And then our child development center offers early childhood development services to kiddos that are 3 to 6 years old, and really work to help achieve their developmental milestones. So we have a wide variety of services in-house, and we work really hard with our clients to support whatever their individual needs might be.
It's an amazing list. And with that list in mind, I'm really curious, what has been the impact of the pandemic on your community?
Yeah, I mean, as you know, all of us have been so impacted over the last couple of years, and I think for the population that CACHC works alongside, so those that are structurally or socially vulnerable, who are homeless, have complex needs, this has been a huge has hugely impacted them. So for a lot of individuals, they weren't able to follow public health measures because they were living in the homeless shelters. They weren't able to stay home and isolate. And I think when everything initially closed down, for a lot of us, that was a real shift. But for a lot of the clients we work alongside, it meant that the access they had to phones or to internet or to safe places during the day, like the library or the malls, or just services that they could only access in person, were no longer available. And I think that was, incredibly impactful. So CACHC really from the early stages recognized that we would need to continue to provide those services in person, following as many of the public health measures as possible. And we did shift to virtual services in a lot of our programs where we could. And I think for us, that was a real kind of eye-opener that we had always assumed, that virtual service wouldn't necessarily work for our clients, but for a lot of the individuals who were housed, by providing them, either access to phones or internet or computers, we were able to provide virtual services to a lot of individuals, and that's actually worked really well for some of our clients. Some of our families do their coaching and their parenting classes that way. Some of our clients see their clinicians that way. We kind of now maintained, even at this stage down the road, this hybrid model where we can. In the initial stages, the community and health services that support this population really rallied together very quickly and created a working group that was targeted to support vulnerable populations, those living in the shelter system. So we met weekly to talk about how we could make sure clients had access to isolation spaces if needed, to make sure they were still getting their healthcare needs met. What were we doing in those cold winter months when they weren't able to access some of those other supports that used to be available? So it was significant for sure to our population, though I think a lot ourselves and a lot of the partners in the community were very creative and innovative, and made sure that we continue to provide services in different ways to meet those needs.
Tell us about your CVP-National project and why it was important that you engaged with your community in this way.
Our project was around making sure that we had access, that clients that we work with had access to vaccines. And specifically, it was identified early on with the working group that I just mentioned that once we heard about vaccines coming out, that we would have to think about how we could provide vaccines to this population specifically. They may or may not have been able to access, the mass sites that were being put in place from, like they maybe didn't have transportation. It might not have been in their area. They might not have had ID or their Alberta healthcare card. So there were a lot of challenges that we anticipated that our population would face, as well as there is that historic, at times, distrust between some of the individuals we work alongside and the healthcare system, or kind of the system that they may need to access in order to get vaccinated. So we knew that we would have to be creative, and we worked really closely with a lot of our community partners, as well as Alberta Health Services and others, to think about what that could look like. And we knew that that would mean in some way, shape, or form, taking the vaccine to the clients where they were at. So getting into shelters, getting out into community, doing outreach out, for those that are sleeping rough, working with those that are housed in some of our housing programs around the city who maybe have limited mobility or access issues, and really taking the vaccine to them. And we knew we wanted to be a part of that, and that we could meet the needs of our population.
You mentioned briefly that you worked with various partners. I'm curious, which partnerships and collaborations did you end up working with? And if you wanted to elaborate on how those came to be and why it was helpful in making your project successful.
Yeah, and I can maybe start and then I'll pass it over to Kim. Like I said, that vulnerable populations working group that was focused on COVID in the initial stages around like isolation and just how we provide service shifted to really focusing on vaccine rollout. So we had some key partners. The Calgary Homeless Foundation initially provided funding to actually staff a vaccine team at CUPS, as well as at our community partner community health center in Calgary, the Alex Community Health Center, as well as through some of the large shelters in the city. And so those partners are shelter partners who provide emergency access as well as transitional and drop-in housing. Were some key partners that we wanted to work alongside, because we knew that's where the biggest need was to get the vaccine to. So, and then as well, obviously funding through various programs to ensure that the vaccine team was able to get out and to work with those individuals.
I would just add that yes, we had a fantastic opportunity to work with both the Alex and the Drop-In Center and the Alpha House and Mustard Seed to really kind of collaborate and create a response to areas where a lot of our population are housed or stay temporarily. And I think we had, established kind of a schedule so that we could not provide services on same day, but provide services throughout the week so that we were able to reach more people, as well as provide opportunities for waste mitigation and that type of thing with the COVID vaccine early on in the rollout, so that we were very intentional about how we were doing our work and making sure that we were supporting one another to do their work at those specific locations.
Wonderful. So as we've mentioned, of course, all of this was funded by CACHC, and we've been so honored that we could, help with this entire CVP-National project. So we've supported the ongoing COVID-19 vaccine promotion campaign. Could you describe any challenges or barriers that you encountered through the implementation of your project?
Yeah, I think, the barriers were not unique to our program. I think they were probably experienced by all who were providing vaccine. A lot of that I thought was the ability to have information that we could share with clients initially. So when we first rolled out, we spent a lot of time what seemed to be waiting for credible information and information to be published that we could utilize to then inform and educate clients on, not only clients, but our own staff. So that was a bit of a barrier, I think, at first. As we continued to kind of roll out services and more information and knowledge became available, we were then faced with the misinformation that was around. We had a very strong group of individuals in the downtown core of Calgary that were anti-vax. There was kind of a movement, if you will. So we had a lot of challenges trying to engage our population with correct and credible information, because there was it was very polarized within the downtown. So that was a fairly large barrier. I think the other barriers that maybe Elaine has already spoken to are around engaging people that do not have trust in organizational initiatives, maybe government, police, health authority, those types of organizations, as well as trusting relationships with people in the community. So we utilized staff at the shelters and at some of the supportive housing buildings to create the opportunity for clients to meet and talk with staff around vaccine, to get information, credible information, and to have, by taking the vaccine to those locations, we were able to provide it in a location where clients felt safe to receive vaccine. So I think those were some of the barriers that we encountered, but also some ways that we were able to overcome them.
And I'll just maybe add a part of our team, our vaccine team, was we had peer ambassadors. And so we found it really helpful to engage, past clients who had either relationships with certain other individuals or who appreciated, understood where some of the hesitancy for this population in particular might be coming from. So they were out chatting with individuals outside the shelters, just engaging in conversations. Anytime we hosted a clinic on site at CUPS, they would head to the waiting room to see if there was anyone they could chat with, out to the front to see who was outside, and really just engage with their peers in a way that none of us as professionals could have. So I think we saw some real success there, and we know that peers bring huge value to our agency, and we were really excited to be able to work alongside them in this initiative specifically.
It's a perfect segue to my next question, which is going to be around the successes. If there's any other ones you want to add, I know that, that education and engagement is huge. As a visible minority, it's important to feel represented and seen around your choices around healthcare. And I'm curious, are there any other successes and achievements that you wanted to name that have happened through this project?
Yeah, I think in addition to the peer support, which I would say were instrumental in the success of this project for sure, I think just having our team out in the community and being visible, I think that people started to recognize what service they were bringing to the community. I think it established some relationships within the community, as well as gave us an opportunity to also talk about other resources that CUPS is able to support, programs that we have, so that there was an opportunity to create some relationships, engage with people that maybe weren't aware of CUPS or maybe aware of what services CUPS can help to support and provide. So I think that was another fairly big win around that, creating trusting relationships with our community partners. One of the vulnerable populations meeting, that was just another way to kind of a success, I think, as far as getting out there and getting known within the community, who's who can we reach out to, how can we collaborate. So I think, we had a great opportunity to collaborate on many levels, as well as the feedback we received from a lot of our clients that we surveyed as part of this initiative, was that they really appreciated kind of the warmness of the team, that trusting relationship that they felt the team brought to the community. So very happy and thankful for that too.
Are there any lessons learned or promising practices that you've identified, not just for COVID-19 vaccination, but in the other vaccination promotion activities?
I think one of the big things for us is certainly the peer support component of our clinic. We were able to engage many individuals to get vaccinated through peer support, and probably 3/4 of the individuals that we vaccinated were probably linked to peer support. So I think going forward, that is something that we are, as an organization, continuing to focus on and integrate into our organization on a multitude of levels. I think the other thing that is very important is that having a very balanced, I think, way of presenting opportunities and education around vaccine, whether it be COVID vaccine or other vaccine, is very important, that we are not pushing an agenda, but providing opportunity for clients to have a conversation with staff that is non-judgmental, that is trauma-informed, that can be repeated multiple times, because we know that with some hesitant clients, that is exactly what they need. They need an opportunity to continue to revisit the conversation. So I think that we recognize, and that is something that we will take forward. The other part is that we have vaccine available. So when clients are on site, they don't have to come back to get vaccinated. They can get it in real time. So I think that is another opportunity for us to just, and I think we do it already, but just as far as the COVID vaccine, having availability when clients are on site and not having to return to get it, making it very low barrier and easy to access, will continue to be our priority.
Yeah, and I guess the only other thing I would add is when the vaccine, when we were implementing that, we really reached out to the other parts of our organization. So our housing teams, our CDC and FTC. And I would say historically with vaccine initiatives, unless they were specific to a certain population, we may not have provided that as intentionally. So going to some of our community development buildings and providing information sessions for those that were vaccine hesitant, and taking the vaccine to those, and really empowering the other staff throughout the organization. So not only those that are in the health clinic, but those that work in other areas, with some, accurate, easy to relay messaging that speaks to the different populations that we work alongside. So anticipating what questions they might have and making sure the staff were comfortable answering them. I think we haven't been that intentional in engaging our other departments and areas around vaccines in particular. And so I think that's something that I hope we can also carry forward is that, and getting, when the vaccines are available for under 5s, making sure we partner with our child development center, and just really making that accessible and using those relationships that other staff at CUPS have with our clients as a way to really answer questions, reduce hesitancy, and provide services.
With the lifting of the vaccine mandate and the mask measures, how does CUPS plan to continue to promote and encourage the uptake of the COVID-19 vaccine as well as other vaccines in general?
Yeah, I think we kind of spoke to that already with just kind of our ongoing engagement with encouraging our staff to be promoting vaccines, awareness of upcoming clinics. So both promoting on-site clinics. We usually have weekly on-site clinics, and then outreach work within the community. At this point in the COVID vaccine initiative, we are one of the only community health centers that is continuing to provide COVID vaccine. thanks to our funding partner, the Calgary Homeless Foundation. So we will continue to collaborate with the Alex, the drop-in center, and the shelters within Calgary to provide doses as well as booster doses to our population.
What needs do you see within your community that rely on investments from both governments and health system decision makers to improve the health and well-being of your clients and community?
Yeah, well, CUPS, as I'm sure many other community health centers, rely heavily on, a real variety of funding to support the work that we do. This includes, government funding, fundraising, donations. And I think as a result, because we provide such a wide variety of services, including health, housing, and education, specifically with government, we receive funding from different government ministries as well. And I think what we saw during the pandemic was, like I said, that collaboration amongst sector partners, both in the community, but also at government, and some collaboration and working across ministries and across sectors, so between social services and health and housing, in ways that we probably haven't seen before. It was a really collaborative approach, and I think there's hope that we will continue to see that kind of collaborative work together, both in the frontline serving organizations, but also from that funding perspective. Our needs at CUPS continue to grow every day. The demand always feels to exceed the supply that we have, and we would love to be able to grow and expand to meet those increasing needs of the clients we're working with. But obviously, we're hindered and limited by funding. We have to look for new funding to expand different programs, and we rely so heavily on that. So I think the challenge can be when funding is received in one area, but the need may lie in another, or increasing resources and services in one area will in turn then increase the need in another area at CUPS, and we may not have the funding there to respond. So it's challenging to grow and expand in a really client-centered way because of some of that kind of funding uncertainty. So we know that we rely on that, and we, like I said, saw some real innovative and responsive funding come from government to meet the needs during the pandemic, and we just really hope to see that kind of collaboration and innovation continue.
What do you think your experiences over the course of the pandemic say about the ability of community health centers to adapt to emerging social and public health issues and the importance of CHCs within our health and social service systems?
Yeah, so I think we've mentioned, what was really highlighted to me during the pandemic is that community health centers are so key in that response. We know our population, we know their needs, and so we were able to adapt really quickly to ensure that the needs were still being met of the individuals that we work alongside, despite all of the constant changes in those early days. I think because we know the clients and the population so well, we did make those quick shifts. We made sure that needs were being met immediately. We worked with partners where other new needs were identified to make sure that our population was responding. And I think that the beauty of community health centers being in the space that they are and providing such wraparound services is that in a time like that with the pandemic, where services and resources may be limited, we were still able to meet a variety of needs of the individuals that we were seeing during that time. I think CHCs are really key and a pillar in providing primary care, both here in Calgary and across Canada. And our goal is really on providing that integrated care, as I know CHCs do, and ensuring that multiple needs are met. And I think that, again, like one of those huge wins coming out of the pandemic that was really unexpected was the innovativeness, not only of CUPS, but our partners to think outside the box and be able to continue to provide those services.
Awesome. I always love asking that question because I never expected to find myself working in community health centers, and everybody's answers always make me feel so happy that I have this role and that I'm able to speak to so many people doing such innovative work in community health centers across our country. I want to thank you both, Kimberly and Elaine, for your time today. And I will ask you my one final question. If anyone wanted to find out more about CUPS Calgary or any of the work that you are doing, where would they be able to find that information?
Yeah, they can definitely check us out on our website at CACHC.com. All of our information is there about the different programs we offer, the different resources we have, and also contacts for different programs if they have specific questions or referral forms and things like that. So definitely check out the website. And you can also find us on Twitter and Instagram and other things as well around CACHC Calgary.
Wonderful. Thank you both again for your time today.
Thank you.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.